Go look in a mirror. Some of the earliest warning signs of a heart attack are not hidden in your blood work. They're on your face, your hands, your ankles. After 60, there are 5 of these visible signs, and most videos won't tell you this. They are not all equally serious. A few are routine. One means call your doctor this week, and one means emergency. Call 911 today. So I'll sort each sign for you. Routine, this week or right now. Keep a mirror handy. Let's start. The routine tier, signs worth mentioning at your next checkup, but not worth losing sleep over tonight. Sign 1. Look at your eyelids at the inner corners near your nose. Any soft, yellowish, slightly raised patches? That's xanthelasma, cholesterol deposits under the skin. A Danish study followed nearly 13,000 people for 20 years and found these patches raise heart attack risk even when cholesterol looks normal. It flags a risk your blood work misses. But it's a marker, not a diagnosis. Routine tier. It means get your cholesterol checked. Hold that thought, because sign 5 is the one that isn't routine at all. Sign 2. Look at your earlobe. See a diagonal crease running across it, from the ear canal down to the edge? That one has a name, Frank's sign. Studies have linked that crease to a higher rate of coronary artery disease. The same small vessel damage that harms your heart's arteries shows up in the tiny vessels of the earlobe. But be careful, it's a weak signal on its own. Plenty of people have this crease and healthy hearts. And it's more common with age, no matter what. Paired with other risk factors, it's worth a mention. Routine tier. Sign 3, and this is the one I most want to calm you down about. Look at the colored part of your eye, the iris. See a pale gray or white ring forming around the edge? That's arcus senilis. You'll read online that it's a heart disease sign. Here's the truth, after 60, it's usually just aging. More than 7 in 10 people over 60 have it. In that same Danish study, this ring, unlike the eyelid patches, did not independently predict heart disease. So if you're over 60, it's most likely nothing. But if you're under about 50 and you see it, that's worth checking. Now we move up a tier. This next one isn't routine. If it's new, it earns a call to your doctor this week. Sign 4. Look at your ankles and lower legs at the end of the day. Swollen, puffy enough that a sock leaves a deep ring, or you press a finger and the dent stays for a few seconds. Swelling in both legs can be a sign your heart isn't pumping as efficiently as it should. Fluid backs up and pools in the lowest part of your body. The tell that points at the heart, it's in both legs, it's new, and it comes with shortness of breath, especially when you lie flat at night. 2 cautions. First, if it's just one leg, sudden. With pain, warmth, or redness, that's a different emergency. It can be a blood clot, and that's a same-day problem. Second, and hear me on this, swelling is one of the most common side effects of blood pressure pills, especially amlodipine. If your ankles puff up and you're on a heart or blood pressure medicine, it may be the drug. But never ever stop it on your own. That's a conversation for your doctor. Either way, new swelling in both legs, call this week. And now the one the whole video's been building to. Not routine. Not this week, right now. Sign 5. Look at your lips, your fingertips. A bluish, grayish tint. A color that shouldn't be there? That's cyanosis. It means your blood isn't carrying enough oxygen. When it shows up on your lips suddenly, it can mean your heart or lungs are failing to move oxygen through your body. This is the one. New blue or gray lips, especially with shortness of breath, chest discomfort, or confusion, is not wait and see. It's not call your doctor Monday. It's call 911 today. Cold hands, turning a little blue, and warming back up, usually fine. New blue lips with trouble breathing? Emergency. Don't ever talk yourself out of that one. So that's the 5. And here's the part this channel always brings you: what this costs and what you can do for free. Good news first, wherever you're watching. On U.S. Medicare, the yearly wellness visit and the cardiovascular blood panel are both covered, $0. On most U.S. private plans, that cholesterol screening is free too. In the UK, Canada, and Australia, your public system covers this same heart and cholesterol check. So find out what it costs you, because it's usually little or nothing. One honest catch: the screening is free. If it turns into follow-up, treating something they find, that can cost you. In 2026, once you're in treatment, Medicare's hospital deductible alone is $1,736. And traditional Medicare has no cap on what a big event can cost. And a big event is expensive. The surgery to fix a heart these signs we're warning you about, a bypass, is billed at a median of about $218,000. So the math is simple. The check that catches this is free. The surgery that waits is a fortune. So here's what to do. Don't diagnose yourself from a mirrors. That's not the point. The point is to walk in with something specific. Take whichever sign you spotted to your doctor and ask one question. I noticed this. Is it worth checking my heart and cholesterol? Or is it nothing? That's it. Not a panic. A question. And if you saw blue lips and shortness of breath, you already know that's not a question for Monday. That's 911. You just learned to read 5 signs most people walk right past in the mirror every morning. That already puts you ahead. Tell me in the comments, did you find one? And which tier was it? Subscribe to catch the next one. I'm from the Body Bill. Every body sign has a price tag. See you next week.